Happy Friday, winners, as promised. Yes, I am back for part two. If you missed Wednesday Night Live, I need for you to go back and watch that video because tonight it is Friday Night Live. Yes, I am here to help you pass your CNA and your PCT examinations. We're going to help you get those jobs in the hospitals, nursing homes, home care. We're going to help you pass and get into nursing school. So, without further ado, let's dive right in. If you all didn't know, Florida Training Academy has partnered with CareerStep in order to offer blended hybrid courses that you can complete at your own pace. For example, our medical assistant training program includes CMA, phlebotomy, and EKG all in one. And yes, we help you with your clinical placements. How do you get more information? You're going to go to floridacareeracademy.com. You do not have to live in Florida in order to take this course. As a matter of fact, as long as you're within the continental USA, you can register. If you want to speak to one of our career advisors, you can call 877-225-7151 and tell them that Nurse Eunice sent you. And if you haven't already done so, we have our CNA bundles, we have medical terminology bundles, and this is our vital sign bundle. So it includes flow charts, it includes practice tests, and it includes additional lecture materials. There is no reason for you to be confused about vital signs as long as you know about Nurse Eunice and Florida Training Academy. We're on question number 1, team. We're going to go through this because it is Friday night and we got stuff to do. All right, so remember this is part 2, so we're not starting on question number 1, we're starting on question 26. And so what is the earliest sign of a developing pressure ulcer? Is it A, an open wound with pus, B, blackened tissue, C, deep wound exposing the muscle, or is it D, red or discolored skin that does not blanch? And I apologize for misspeaking, but this has been a Friday. So, yes, that is right. I see so many correct responses coming through. If you chose D, you're absolutely correct. Remember, it depends on the skin tone. So, if their complexion is a lighter complexion, they may turn red. But if they're dark skin, they're not going to turn red. It can be purple, it can be gray. So, the correct term is discolored versus red. The rationale is non-blanchable. Redness is signs of a stage 1 pressure ulcer, meaning that tissue damage has begun. So if you see something that looks abnormal, of course you're going to notify your nurse and reposition that patient in the process. 27. A resident with a history of falls insists on walking alone. Stubborn patient. What should the CNA do? A, restrict the resident to the bed. B, allow them to walk unassisted. C, encourage them to use a walker or a cane. D, tie a resident around their waist. I know what you want to do, but what you want to do could be assault. So we're not going to restrict them. We're not going to tie them down. What we're going to do instead is going to be C. You're going to encourage them to use a walker or a cane. That way you can promote safe independence while reducing fall risk, and that would be key in resident care because they do have autonomy. They have a right to refuse. So you're going, hey, Mrs. Lucas, let's get you to try to use the walker versus you walking without it. I am not doing that. Well, just distract them and press that nurse button. And then maybe you and the nurse can walk with the patient down the hall. Okay, so there's ways to get them to walk safely versus having them try to do it without our assistance. Question 28. A resident with Alzheimer's is becoming agitated. What is the best way to respond? A, argue with the resident. B, use a calm voice and provide reassurance. C, restrain the resident. D, ignore them until they are calm. Ooh. If an Alzheimer's patient who is agitated becomes calm, is that a good thing or a bad thing? So it's not going to be D because they could be over sedated. They could be asphyxiated. So we're not going to ignore anybody. That is right, team. Great job with your communication. It is going to be B. We're going to use a calm voice and provide reassurance because calm, reassuring communication helps to de-escalate agitation in dementia patients. So we don't ever escalate. We try to keep low voices. We want to have a therapeutic tone and try to understand where their patient's coming from. Question 29. A hospice resident is experiencing labored breathing and cold extremities. What does this indicate? Is it A, dehydration, B, urgent need for CPR, C, anxiety attack, or D, signs of impending death? All right, revealing the answer in 3, 2, and remember they're on hospice, so it's palliative care only. We're not going to perform CPR on them. So yes, the answer is D. Labor breathing, and that would be like the death rattle is something you can research, but that would be signs of impending death. And of course, those cold extremities, because the heart is failing, it's not circulating the blood. All of those suggest that the body is shutting down, and those would be D, signs of impending death. Question 30. A CNA feels overwhelmed by work tasks or work stress. What is the best coping strategy? A, avoid talking about it. B, take breaks and practice deep breathing. C, ignore the stress and work through it. D, work extra shifts to distract themselves. So you're overwhelmed by work stress, not by family stress. So you know where you're going to act out at? You're going to act out at work and around your family members. If you are overwhelmed, you need to do B. You're going to take a break. Look, we don't need you being mean to us, and your kids and your family members definitely don't need you being mean to them. So remember that self-care and stress management help to prevent burnout. If you need to take some time off, go ahead and request it. Go on vacation. Even if you're doing nothing more than just taking a walk along the water and just turning your phone off that day. We need for you to take care of yourselves so that you will be able to take care of others. Question 31. A CNA notices a coworker failing to wash their hands between residents. What is the best action? A, report the issue to the charge nurse. B, ignore it. C, confront the coworker aggressively. D, notify the resident's family. Your coworker did not wash their hands and they went into another resident's room. How are you going to respond? Now, I see some of you all putting C, but it wouldn't be C because we don't confront people aggressively. They're going to feel attacked. And so therefore, the answer is going to be A. That is right. You're going to report that to the charge nurse. Infection control violations should be reported to protect residents. And what will happen if you come and you tell me, I'm just going to have my little clipboard and I'm going to start watching everybody, not just that one CNA, as they come in and out of the rooms to see if they're foaming in, foaming out, to see if they're washing their hands. And yes, that way we can have a whole in-service thanks to that one person on hand hygiene and infection control techniques. Let's go to question 32. And congratulations. I see so many of you all saying that you passed your examinations. For those of you all who have exams coming up, I wish you much success. I know you can do it. 32. A resident refuses to take a shower. What is the best CNA response? A, respect their choice and offer alternatives. B, force them to bathe. C, ignore them and document noncompliance. D, report it to the nurse immediately. A client refuses to take a shower. And you know what you're going to do when they refuse? You're going to respect their right to refuse. Yes, it is a great job. They have autonomy. They get to make their own decisions. We don't own them. They are not our kids. But in respecting their autonomy, go ahead and compromise. Be respectful. Well, Miss Lucas, I understand you don't want your bath at 8 a.m. You say it's cold in here. When I warm the room up, give you some extra blankets, is it okay if I try to come back at 11 a.m. and give you your bath? And then at 11 a.m., when she's now, going ahead and refusing again, make sure you document it that you offered at 9 a.m., you document at 11 a.m., and now get your nurse involved. Because what we don't want is at 6:59 p.m. when it's time for you to go home and her daughter comes in, her daughter's asking, why didn't mom get a bath today? So we don't do baths at the change of shift unless it's a major bowel movement. All right. So hopefully it's going to help you, but you have to coordinate care. You have to document because patients get confused as it gets darker. We call that sundowners. And if you don't document it, it's going to appear as if you did not attempt to bathe them all day. 33. A CNA is assisting a resident in isolation for tuberculosis, also referred to as TB. Which PPE is required? Is it A, gloves and gown only, B, surgical mask, C, N95 respirator, or D, face, shield, and gloves? If someone has tuberculosis, what is required at a minimum? That's right. It is going to be C. You need an N95 respirator because TB is an airborne disease. You can wear gloves. That's cute. But you're breathing this in. You're breathing those germs in. So you need something to protect your airway. So TB is an airborne disease requiring N95 respirators for protection. And your facilities will have you do a fit test, and they will make sure that you have the appropriate size N95 to take care of your patients and to protect you from TB exposure. 34. A resident with C. difficile is experiencing diarrhea. What is the correct way to clean your hands after assisting them? Is it A, alcohol-based hand sanitizer, B, rinse hands with warm water only, C, wash hands with soap and water, or D, wipe hands with disinfectant wipes? Remember, when you're taking your test, you have to understand key terms. And so this key term said C. diff, and another key term was diarrhea. And anytime you hear those, I need for you to wash your hands. We're not using hand sanitizer because the diarrhea could be caused by C. diff and we don't know it yet, or the patient could have a confirmed case of C. diff. C. diff is a spore, and it is really hard for the hand sanitizer to permeate, to go through that spore in order to kill the bacteria. So what we're going to do is we're not going to worry about killing it with hand sanitizer. We're going to use soap, water, and friction to remove those germs off of our hands and to wash them down the drain. So again, the answer is C. C. difficile spores are not killed by hand sanitizer and require soap and water hand washing. 35. A resident asks a CNA to check their blood sugar. What should the CNA do? A, give the resident juice to help raise the blood sugar. B, ask another CNA for help. D, inform the nurse, as CNAs cannot perform this task in most settings. Or D, check the blood sugar immediately. A resident says, hey, I don't feel well. Can you come and check my blood sugar? And what are you going to do? Oh, we're torn on this one. I see D's and C's. All right, remember, you don't report to a patient. You report to C, the nurse. You have to make the nurse be made aware. You can't be in there just checking someone's blood sugar if it wasn't ordered by the doctor. So it's going to be C. You're going to inform the nurse because in some of your facilities, only the nurses can perform the finger sticks, the glucometer checks, because only the nurse can then provide the appropriate treatment if the sugar is out of the normal ranges. So here's our rationale. Blood glucose monitoring is usually outside of the CNA scope of practice, unless trained as a certified medication aid or, if you're in the hospital sector, a patient care tech. But each facility has its own policies, and some facilities do not allow CNAs or PCTs to check the blood sugars. They feel that is a nurse function. 36. When providing care, which type of gloves should CNAs typically use? Is it A, sterile gloves, B, clean, non-sterile gloves, C, no gloves at all, D, reusable cloth gloves? Now, we all know that D doesn't exist. I think reusable cloth gloves are called mittens. We wear those in the wintertime. We do not wear those during patient care. So, of course, it's not C. Of course, it's not D. Process of elimination, team. Yes, it is B. We're using clean gloves. We're using the gloves that are in the room and the boxes. So CNAs can use clean gloves for routine care because sterile gloves are reserved for invasive procedures performed by nurses and doctors. So when you take your CNA examination, you cannot perform anything invasive. If they mention wound care where you have to pack, or if they mention sterile techniques, sterile dressings, that would be outside the scope of a CNA. Remember, once you are a CNA and you work at a hospital, they don't entitle you. They don't title you a CNA. They title you a patient care tech, at which point they will teach you sterile technique. They may even teach you how to insert an indwelling catheter. What you know it as is a Foley catheter. But until that point, for your test, clean, non-sterile gloves only. The way I like to think of it is you can do baths and boo-boos. That's about it, okay? Nothing invasive. 37. Which arm should be avoided when taking blood pressure on a resident with a mastectomy? What is a mastectomy? That's when part of the breast tissue is removed. Which arm should be avoided if a patient has had a mastectomy? You have to take a blood pressure. So is it going to be A, the arm on the side of the mastectomy, B, the unaffected arm, C, either arm is safe, or D, both arms at the same time? Ouch. Yeah, we don't do D. So you're right, everybody. We're going to avoid the arm that is on the side of the mastectomy. So it's going to be A. Whenever you are taking a blood pressure cuff on the side of an affected arm, especially if a person has had a mastectomy, we also remove, when I say we, the doctors also may remove the lymph nodes. And so that arm may be at risk of swelling. It can have lower fluid circulation or lower blood flow. So therefore, the blood pressure taken on that arm would not be accurate, or it's going to cause pain to your patient. So here's your rationale. Taking the blood pressure on the mastectomy side increases the risk of swelling, lymphedema, and also pain to your patient. So don't do it. Also, something else that your nurse may ask is whenever we get this new admission in, and we can't tell always who's had a mastectomy, because once they've actually been in remission for a few years, they may go and have surgery in order to reimplant breast tissue. So you don't look at someone and automatically know they've had a mastectomy unless they've not had, any surgeries afterwards in order to reconstruct the breast. So what you do is you would ask, is it okay if I use the left arm? Is there any reason why I can't use the left arm? Whenever you ask questions like that, it will prod their memory and they can say, oh, no, 5 years ago I had a mastectomy. You can't use my left arm. And then as the CNA, you would put a sign based on your facility's policies over the head of that person's bed, or maybe a band on their arm, so that everybody knows, including the person who comes in to draw the blood, that that left arm is off limits. Question 38. What safety precaution is most important for residents with diabetes? Would it be A, soak the feet in hot water, B, cut toenails short, C, inspect feet daily and report changes, or D, massage between the toes? Most important for residents with diabetes. That's right. We know that a person with diabetes is more susceptible to foot ulcerations, infections, etc. So we have to do C. We have to inspect their feet daily and report any changes. Again, diabetes increases the risk of infection and poor healing. So early detection is vital. And if you don't know how to perform foot care, if you don't know how to perform some of those skills, don't forget, whenever you go down to fltraining.com, you can click on our clinical skills videos, or whenever you go to nurseeunice.com, do the same thing. Look for the CNA clinical skills videos. And we have a full library that also includes foot care, hand and nail care, brushing teeth, feet in a resident. We help people from all over the nation and outside of the United States pass their examinations and become better caregivers. What we like to say is that we help you study smarter and care better. If you've been here this long, you might as well go ahead and give us a thumbs up, share the video, tell a friend to tell a friend, because you all, we're on question 39, Friday Night Live. 39. A resident has fallen, but they say they feel fine. What should the CNA do? Now think about somebody in home care. Like, what are you going to do? Is it going to be A, are you going to help them up immediately? B, ask if they want to go back to bed? C, ignore the incident since they say they are fine? Or D, stay with them and call for the nurse? When you're taking your CNA examination, it's not about one particular environment. When you're taking your CNA exam, remember you're taking care of someone who is elderly. They have to be an adult. So you're taking care of someone who is elderly. And I want you to really specify, really target the elderly population, whether it is home care, nursing home. So don't get so stuck on hospitals. Okay. So if this person has fallen, we don't get them up. We're going to keep them on that floor, make sure they stay breathing, put a pillow under their head, but you're going to do D. You're going to stay with them and call for the nurse. And the nurse may say, hey, you have to call 911 if you're on home care. But at least make the nurse be made aware. If you're in a nursing home, of course, we're going to come in team lift and help get that patient back to the bed. Here's your rationale. Even if a resident feels fine, they must be assessed for injuries before being moved. So don't you do it by yourself, CNAs. Question 40. A CNA is using a mechanical lift to transfer a resident. What is the most important safety step? Would it be A, have at least 2 caregivers assist? B, ensure the resident holds onto the lift straps? C, move the resident quickly to avoid discomfort? Or D, skip using a lift if the resident prefers? So think of a lift kind of like a crane with a pad attached to it. So you're going to roll the patient from side to side and put this pad beneath them. And then you're going to connect this pad to a crane. And now you have to maneuver that crane to get the patient from the bed to the wheelchair or the bed to the chair. And that sounds like a lot, doesn't it? Because it is. So therefore, you never do that by yourself. It is going to be A. You need to have at least 2 caregivers. Safe mechanical lift use requires at least 2 caregivers to prevent injury. One keeps a hand on that patient who's in the air, hoisted up via that pad. And then the second one is the one who's maneuvering the lift. 41, and we're going all the way to 50. Where should lotion not, keyword not, be applied during foot care? Is it A, heels, B, soles of the feet, C, between the toes, or D, ankles? Revealing the answer in 3, 2, and that's right. Look, I know, I'm a Floridian, so I understand. I don't want any crusty areas between my toes, but let me tell you the difference between me and somebody who's older. I still have full sensation of my feet. I can see, I can maneuver, I have range of motion. So I can actually look down and see if something doesn't look right. Whenever you're taking care of one of your residents or patients, sometimes they are leg swell or they could be a diabetic. Now they have vision changes and limited range of motion. And you've put a whole bunch of lotion between their toes and put on some socks. You have just created a breeding ground for fungi and bacteria. So no, I know what we do in the real world for younger people, but for our elderly population and for your test, lotion between the toes traps moisture and increases infection risk. And that is not something that we do. So the correct response was C. Give yourself applause. 42. If vomit or emesis, say it with me, emesis. Emesis is the medical term for vomit. So let me repeat this. If vomit or emesis looks like coffee grounds, it may indicate which of the following: A, a stomach bleed, B, normal digestion, C, food intolerance, or D, dehydration. Your patient just vomited. and it's brown and it's granular and it looks like coffee grounds. What does that mean? And it's not for you to be sitting up there trying to diagnose. It's for you to get that nurse in that room like ASAP. So yes, the answer is A. It's a stomach bleed. Coffee ground emesis suggest old blood in the stomach or GI tract. And go ahead and put in the chat. When we say GI tract, what are we referring to? What does GI means in relation to the body systems? All right. And so I expect to see that in the chat. And great job. 43. Ooh, let me pause. Go ahead and get your pen and paper. You need to get your pen and paper because we have some medical math. On your test, you may have 1 or 2 conversions. And so let's talk about them now. A resident drank 6 ounces of juice and 4 ounces of coffee. How many mLs or milliliters should be recorded as intake? And so let me help you out. 1 ounce equals 30 mLs. So there's a 1 to 30 ratio. How many ounces do you have total? So if there's a 1 to 30 ratio, once you know your total amount of ounces, you multiply that number by 30. All right, that's your hint. I'm revealing the answer in 10 seconds. And 1, let's see. Yes, it is D. We had 10 ounces and we multiplied that by 30. So we know that our resident had 300 mLs. That is perfect. So in this equation, I separated them. I did 6 by 30 plus 4 by 30. But in reality, what I do is I just total up all the ounces and then multiply by 30. And at the test, you may not ever have to get to the answer, but at least you need to know that it's a 1 to 30 ratio. And they usually don't allow you to use paper or anything, so you don't have to normally get the answer. So just keep that in mind. You need to know how to get to the answer, but it may just ask you, would it be 10 by 30, 8 by 30, 12 by 16? They're just asking you basic questions. Why is this important? Because what goes in should match what comes out. And if you want to hear that whole spiel, you have to go back and watch part 1 from Wednesday Night Live. I have another conversion for you. Are you ready, team? All right, 44. A resident weighs 154 pounds. How much is their weight in kilograms? Because when we're given medications, we don't do that. It's not based off of pounds. It's based off of kilograms. So when you get a person on a scale, yeah, you have it set to pounds, but there's conversions that take place, whether you know it or not. And so is 154 pounds the equivalent of A, 60 kilograms, B, 70 kilograms, C, 80 kilograms, or D, 90 kilograms? All right, I'm going to give you 10 seconds before I reveal the answer. Look it up fast. Phone a friend. Yep, I see a lot of you all putting the correct answer in the chat. Great job. Whenever you're going from pounds to kilograms, you divide by 2.2. Yep, so 1 kilogram equals 2.2 pounds. Remember, we had 154 pounds, so we're just going to divide by 2.2. And that comes out to 70 kilograms. Divide the pounds by 2.2 in order to get the kilograms. Practice it without me. I promise you that works. All right, let's go to our next question. 45. A CNA overhears a nurse talking about a resident's condition in the hallway. What should the CNA do? A, ignore it. B, join the conversation. C, remind the nurse about HIPAA. Or D, report the nurse to the family. Why y'all trying to get that nurse fired? Yeah. Sometimes our younger nurses, they're doing some strange things. This whole social media frenzy where everything has to be posted is costing a lot of healthcare providers their jobs. So Whether it's someone talking about a resident in the hall or if it's somebody who may be deciding to shoot a TikTok video while they're at work. I want you to do C. You're going to remind that person about HIPAA, about the Confidentiality Act. So discussing a resident's health in a public space violates HIPAA. You're not joining into that conversation because if you do, you could be liable and sued and or lose your license also. 46. When collecting a clean catch urine specimen, the CNA should A. Collect the first urine stream, B. Collect midstream urine, C. Collect after urination is finished, or D. Use any available container. So clean catch. What are we talking about? All right, revealing the answer in 5, 4, 3, 2, and yes, it's B. So usually there are going to be wipes in the bathroom. You're going to ask the resident to wipe. They're going to wipe themselves, and then they're going to start urinating. And then midstream, you would put the cup under them to collect the urine. We don't want the first urine that's coming out because it's going to contain bacteria. So a clean catch urine is a midstream urine collection. So let's read the rationale. Midstream urine reduces contamination from skin and external bacteria. 47. A hospice resident complains of pain, but their medication is not due. What should the CNA do? A. Ask the nurse to give an additional dose of medication. B. Tell the resident to wait for the next dose. C. Offer repositioning or comfort measures. D. Double the next dose. Your hospice resident complains of pain, and I know you don't want to see anybody in pain, but your nurse is not going to give medication early. So the answer is not A. And you're not going to tell the resident to wait for the next dose. Remember, as a CNA, you have a scope of practice. So the answer is going to be C. Non-medication pain management, such as positioning, massage, distraction, play some music, read a book, get them up for a walk, sit them in a chair. Those are comfort measures that a CNA can provide, okay? So not everything should be treated with medication. There are some non-pharmacological methods, and that is what CNAs specialize in performing. 48. We talked about S-bar in part 1, so remember, go back and watch part 1. It was from Wednesday. So which S-bar component includes the reason for calling the nurse? Is it A, background, B, recommendation, C, assessment, or D, situation? And I like this because whenever, yes, you have to give a report to as a CNA. You're giving a report to the oncoming or the outgoing CNA, and then you're also giving a report to the nurse. And whenever you're giving information, it needs to be straight and to the point. So we use the S-bar format. S stands for, yes, you have it. It stands for situation. So I don't want to hear about your assessment. I don't want to hear that. I want to hear, hey, Eunice, the blood pressure is 200 over 110. That is the situation. I can figure out the BAR later. Okay, so it is D. Situation is where the CNA describes why they are calling a nurse. So let's get rid of some of that fluff. Tell me what you really need to tell me first. And then as we're running to that patient's room, you can tell me about the background. Well, she just started saying she had a headache and her headache's rated a 7 out of 10. But some of you all would tell me about the headache before you told me about that elevated blood pressure. So make sure you put priorities first whenever you are telling your nurse about the patient's situation. Question 49. How can a CNA best manage time during a busy shift? A, prioritize care based on residents' needs. B, take breaks before all work is done. C, skip documentation to save time. D, do all tasks for one resident before moving to another. This one I think has two decent answer options. What do you think is the best option? Yep, I feel you. I'm torn between A and D too. But let's say you had 8 patients. One needed to be prepared for surgery, but the one who called you the most was stable. They were preparing for discharge. And so what you did was, because the one who called you the most was the most needy, you spent all your time with them. And you know what you did not do? You did not prepare your patient for surgery. They didn't get their pre-surgery bath. They didn't get wheeled to the surgical center on time. And so the correct response is A. When you're a new CNA, you may not know what the priorities are. So you know what you're going to do? You're going to ask the nurse, hey, I'm new. I want to make sure I get this right. I think that this person's the priority. Would you tell me who you'd like for me to see first? Okay. So yes, we need for you to prioritize care based on the resident's needs. Some of your residents who are not as critical are going to call you more frequently than your patients who have really serious conditions. So you have to make sure you understand time management. And you can always say something like this: Miss Lucas, I do understand and I enjoy being in here with you. Is there a family member you'd like for me to call? Because I have to go and check on my other patients now. All right, so rationale. Time management involves prioritizing critical tasks first. Okay, so if you're standing in your room talking to a resident, that's not a critical task. Communication is important, but while you're communicating with Miss Lucas, Mr. Lee is going to be late for his surgery. Question 50, team, we did it. Which item should be kept at the bedside of a resident on seizure precautions? Is it A, hearing aid batteries, B, blood pressure cuff, C, suction equipment, or D, an extra blanket? What do we keep at the bedside of someone who has seizures? All right. Not an extra blanket, so it's not D. I know you want to pad those rails, but we're going to need more than some extra blankets. We're actually going to need some padding for the rails. So the answer is not D. You all, whenever someone starts to seize, they're at greater risk of aspiration. So the answer is going to be C. Suction equipment may be needed to clear secretions and to maintain the airway during the seizure. And so I hope that you learned a lot. Look at us, you all. We did our 50 questions. Remember, the first 25 was from Wednesday Night Live. And for you all who stayed with me the whole night on a Friday night, can I tell you how much I love and appreciate you? You are so awesome. Or if you're watching us on a Saturday morning, same exact thing. I love being your mentor. I love helping you prepare for your exams. Remember, you're doing this the right way, because you're going to be one of those caring CNAs. You're going to know terminology. You're going to know how to do the skills, and that's going to make you a caring nurse. So you all have a wonderful weekend. Don't forget to like, share, and subscribe. Thank you for watching, and I will see you for the next Wednesday Night Live. I'll see you Wednesday, everybody.